Hey, my name is Marcus. I live in Darwin and I'm a lawyer by profession, and I've had a fair bit of dental work done over the years for my own health. It's frustrating because you make an effort to see specialists, which doesn't happen overnight. It usually, for me, involves travel, and then you make all the arrangements, which are usually months ahead. You have to see sometimes in the same location, sometimes in different locations in the same city, and you realise that after an hour and a half with your mouth open, the orthodontist says, "I cannot find a driver to undo your teeth, to expose your implant." To have a deep clean every 2 years or 3 years, you actually need to remove the tooth that's sitting on top of this implant stem to get in around the edges of the implant. And it can be done with it on, but you cannot get the right angle so you can get in all around. And so there's always blind spot, which for the long-term health of your gum line and your implant needs to be exposed every now and then. And you get the prosthesis office, there is a little driver. It's a little screwdriver, but it's a specialist insert because there's so little tolerances that you can't use a normal screwdriver when there's a Phillip heads and stuff like this. You need a specific. And over the years, there have been so many different manufacturers of these implants and I have 2 different types of implant because of the risk of failure in those days. We went half, so I have a double worry of having different implants mix and match, create a degree of redundancy and not total failure. So when I go there, they can get my upper bridge off, and then they say, "Sorry, we can't get your lower out." All they're saying is, "Oh, I used the wrong driver in the top and now I have to repair the screw that holds everything in place." And so you sit there and the gentleman or the professional goes, "Sorry, I can't get this out. I can't find a driver. I've got my entire arsenal of drivers. I can't do it." You ask them and saying, if you had my records of which implants I had and what type of driver it is, and you had this beforehand, could you have avoided this problem this morning or this afternoon while I've had my mouth open for an hour and a half? And they said yes. Well, it's basically a register that can be accessed because there's so many different implant products around that failures in those products usually take some years to come to the fore. And that's what happened to me. And I was so glad that I had different types of implants, because there was a certain implant or a group of implants, they all failed within a period of about 6 months. And I was so glad that I had others in, but also that would actually, over a period of time, create information that's available to a periodontist to say, "I am not using this implant because there is data coming out that these implants are not viable for the long term." And I think that's also important. Orthopedic surgeons with hip replacements and knee replacements and a whole lot of bits they put in people's bodies used to fail incessantly, all these different products. And it wasn't until they got a registry together that failure information became widespread, and that prevents a whole lot of heartache for the patient, for the surgeon who thinks he's doing the right thing but he's getting a product which has no longevity for whatever reason, because all of this stuff is a continuous knowledge-based progression. The most important question to ask, and it says, the people who are going to be doing this, are they qualified to do this? is this your full-time job or is this your part-time job? And don't let anyone say, I can do this and it's just in and out and you'll be fine. It is not worth the risk. So there needs to be a bit of care and knowledge that only comes with specialization, because once these implants are in, the angle they end up at is the angle they're going to be forever. The other thing I can say is this: there is products made in different countries, and implants and everything that attaches to those are high-tech pieces of equipment. Every piece needs to be checked before it goes on the market, not every 10,000 pieces, because I've become aware that there's a whole lot of product failures, not because the metal doesn't sit properly within the bone structure, but because the bits that go together are failing and not sitting together properly. Having implants is not it's like I have a piece of metal in my body. The information that's kept is actually kept to save the patient or the implantee money, time, and a lot of hassle, because it allows that efficient maintenance of your implant over the next 20, 30, 40 years. And so I don't have the same issues arising in my head as I go through the process about the implant, because I know the issues I've had in the past not having a register, and I know that the issues that I had can be overcome by having a register. Unless I want to walk around with all these records in my pocket and deliver it to each new professional that I need to attend, to have my implants maintained. There's nothing about your person in there except the implants, the mechanical bits that are sitting there. It's just you can keep it on your computer and deliver it as you want to, or you can just have it sitting there to be known. And also it creates a better system for the future, because all the dodgy products, which usually equate to price, are going to be highlighted fairly quickly. The future me's can rely on that through their professionals to say, you don't want these implants, you need these type of implants, etc., etc. It's actually avoiding a whole lot of issues by having this register. First of all, I would expect that professional person to tell me that there is a registry, and hear the positive things that why you should register your implants. And if you ask and you say, I would like my implant and everything to do with it registered, and the professional person says, oh, there's no need to do that, or is hesitant, I would walk straight out the door, because the person who is doing the job is not standing behind you. They're just standing behind themselves. They're not looking after your long-term welfare. They can go off having a holiday and never come back, and you're just in limbo land forever about what's actually in your mouth. And the other thing is this: it's a long-term relationship. My dentists have changed, my doctors have changed, but my prosthodontist until recently, and my periodontists have been there for the last 15, 17 years.